my name is Whitney and I'm a dental hygienist. If you're new here, welcome. If you've been here before, welcome back. Today we're going to talk about some tips and tricks for cleaning a patient's teeth who has braces. And before we get started, a quick shout out to the Teeth Talk Patreon and the YouTube members who support this channel. I love that you are part of this mission with me on spreading evidence-based dental health information. And having said that, let's talk. First, I always have the patient do a pre-rinse so they can swish anything out that may be stuck between their brackets. There's a lot to clean with braces, but if you want to not feel defeated, what I do is I clean all of the linguals first, and then after, I do all of the facials, the braces afterwards. You know, I get my endurance up, my confidence up with the easier surfaces, the linguals, before I start to clean the difficult surfaces, the facials.
If it's too much water, you need a break or something, just raise your hand.
Now for the difficult surfaces, the facials, I always use an ultrasonic piezo or Cavitron. I like to use a high speed as well as keeping the saliva ejector in the corner of the mouth. The high speed suction follows me around all of the facials. Also, if there's a lot of buildup, I'll go around each bracket kind of quickly, like not a normal cleaning, right? And then after I do that, then I go back and do all the normal scaling motions, wrapping around each tooth, interproximal. But first, I prefer to get most of the plaque off, and then after I go back in and do a good cleaning. So what you're seeing is me going around the bracket. Oftentimes you'll see some stain and it comes off really nicely with ultrasonic. Please note also that there was a camera very close to me right next to my hand. So if my technique isn't perfect, it's because I was really looking at a weird angle and I didn't have a mirror. So next up, when I'm done with the ultrasonic, I'm all about using the air. I blow air everywhere because there's so many nooks and crevices that are easy to miss with braces. So when the air dries off the teeth, then you can really see where you need to get with the hand scalers. I use the same scalers that I would use even if the patient did not have braces. I like my 6-7 sickle for the anteriors, and I usually use some kind of universal scaler in the back for the posteriors, sometimes even a curette. This part I kind of do as a regular cleaning. Of course, the braces are there, but once we already removed most of the plaque and tartar and stain off with the ultrasonic, now we're just fine tuning, right? So I think that's the way to think of it. So let's fine tune. Sometimes I also use a 204S for the posteriors, so that can get in there pretty good too. Whatever you're comfortable with.
I'm poking a lot. You're okay?
Mm-hmm.
Okay.
Always check to make sure they're doing okay. However, I do notice that patients who go through ortho, like when you're at the orthodontist, you have much worse things happening than a little poke during a teeth cleaning. I feel like this is nothing compared to the braces tightening that they do. They're technically not tightening, but when you're getting your new bands and stuff, that's way more uncomfortable. The wires hitting you and stuff like that at your braces appointments as opposed to your teeth cleaning appointments. But still always check, make sure they're doing okay. Okay, now for the polishing. Some clinicians prefer to use these brushes. Look at me doing like a makeup swatch. But yes, some prefer these brushes instead of the cup, but I kind of like using the regular cup, but I'll show you both. So first I polish everything above the brackets, and then I polish below, and then I polish interproximal. So I'm just doing all the facials right now, but I'm going to do all the linguals when I'm done with the regular cup. And if you don't have the cup, you can use this brush on the linguals as well. But like I said, I'm not sure how I feel about the brush yet. Maybe one day I'll love it, but not usually my first preference. However, it does clean the occlusals really well. I do like that about this. Next up is floss, everyone's favorite part with braces. Just kidding, but no, it's fine. What really makes it easy for me is to tie a knot so you won't have to worry that it's going to come apart. If you tie a knot like this with the floss threader and the floss, it makes it so much easier. Now we floss the braces. I like to start in the midline like I always do. I go through like that, and then I go down, and then I do a normal floss up and down and up and down. Sometimes it's nice to have 2 strings of floss to go through because then you're like really going through, but sometimes it doesn't work. It depends on the patient, it depends on the tooth, and we floss the whole mouth. Once we're all done, I double check with the air again because I'm always double and triple checking, making sure we didn't miss anything. Again, there's lots of crevices with braces. You want to use a lot of air. Lastly, it's always a good idea to do a fluoride treatment for your braces patients, your ortho patients, so you would end with the fluoride.
And do your teeth feel okay?
Yeah, I feel good.
Okay.
Thank you for watching. I hope this video helped you. Please like and subscribe and turn on your notifications if it did. And again, thank you to the YouTube members here and the Patreon members supporting this channel. If you want to join the fight in making sure evidence-based health information is being shared online, become part of our Teeth Talk community. The links to join are in the description box below. And until then, I'll see you on Instagram at Teeth Talk Girl. Peace, love, and teeth.